MYWHTC clinic. Thank you, Mr. Patrick, for joining us. Can you just give a quick introduction about yourself and how long you've been in the hair industry for our viewers?
Yeah, my name, of course, is Dr. Patrick Mwamba. I've been doing hair transplant for 16 years, but
Wow.
of course, it was not my first passion, because when I studied my medical school, I was in Belgium doing hair surgery, doing general surgery. Then I decided to move to US just because I wanted to go to the US, you know, the American dream. And when I get there, I met Dr. Cole in '99, and he introduced me to hair transplant surgery. I was a little bit skeptical about it because it was my first time, never heard about it in my medical career. But then I just found out like it was a tremendous field, because all the research, all the new things that was occurring at that time, strip, microscope using or not. So, and at the beginning, really, I even told my mentor, Dr. Cole, that, hey, I'll be here just for a year, because I was trying to prepare my USMLE, the exam for the US, and my goal really was how to conduct a talk with patient, you know, so to kind of improve my English.
Do you do FUT and FUE or just FUE?
No, I do both.
You do both?
I do both.
Can I ask what percentage you do FUE and FUT?
I will say 85% FUE now and 15% on strip. Just because, like, most of the patients, when they come to me, it's because they know that I'm good in FUE and they demand that. But of course, you got to follow indication. Let's say in black women, I propose FUT first because of the indication. We know that FUE, especially on black people, it's very difficult, and you can increase the transaction. You can have problems with the growth. So I kind of encourage people to know everything so they can really offer customize your treatment.
Brilliant, brilliant. You mentioned earlier on about technology. Do you believe, or do you think the technology has changed? Have we come far from technology, or do you think the technology that's coming now is too slow? Is the field developing too slow, or is it the equipment that we've got now, is it appropriate, or you think it can be better?
I think the technology, it still has to improve, but more than the technology, I think it's the user of the technology that has to improve their knowledge, because what we realize today, it's a lot of beginners who are really focused on the technology without knowing the basics.
And where do you think technology will be in 10 years' time?
I will be fantastic, because I think everybody will be like more thinker than doer. So we'll make that happen.
As you know, BaldGossip, it's all about patients who had a bad hair transplant. Either the expectation was too high, you know, the lack of density, or the scarring at the back. So obviously they're looking for another surgeon to repair the hair transplant. What advice would you give them when they're looking for another surgeon to repair the hair transplant? What advice would you give them, bearing in mind the first one was a failure, second time they're more nervous now and thinking, oh, is this the right surgeon again? So you obviously bear that in mind. So what advice would you give them?
The advice I will give them is, as I always say, do your homework. Go talk to that physician, make your research first. And I think forums like BaldGossip will help them to kind of have that kind of knowledge about what they're looking for. And just check. Usually you will see different physicians with different specificity. And then you talk to them, you talk to your physician, and you explain clearly your goals, because it's a journey together.
I think obviously the patient needs to be a lot more comfortable with the surgeon this time.
Yes.
And believe in the surgeon.
And believe in the surgeon, and not only believe in the surgeon, but make that trust. So they have to tell exactly what they feel about the field, what they feel about their expectation, and discuss that deeply with the physician.
Finally, obviously, patients do think about, oh, will a repair work? Will it cost me more money? So do you charge more money for having a repair case done than a normal case?
Yes, just because it's more work, and because I usually tell the patient, the physician doesn't charge really the result. We charge the labor, the time we're spending. And a repair case, you spend a lot of time. And definitely it will cost a lot of money.
What would you say a patient should ask a surgeon? One question that they should ask. What question will that be? And this is your final question, shall I say, because due to time. So what one question would you say a patient must ask a surgeon?
Naturalness. Will I look natural after the surgery?
Brilliant. Thank you very much, Mr. Patrick. Thank you for your